My name is Kelsey Cook. I'm going to be doing my physical assessment on my patient, Lexi. First, what I'm going to do is kind of let her know what I'm going to be doing. I'm going to be checking your whole body. So everything on your face, your abdomen, and stuff like that, I'm going to be pushing around. Are you okay with that? Okay, so now we're going to begin. The first thing we're going to do is examine for symmetry on her eyes, her nose, her mouth, and her ears. And her ears look like they're symmetrical. Her eyes are symmetrical, her nose fine, and her mouth is fine. Okay? Now, can you smile real big for me? All right, and now frown and look really excited. Okay, so her expressions were normal. There's no drooping or anything like that. Everything was symmetrical there. Now I'm going to check her eyes. And can you take off your glasses for me? Okay, so now I'm going to pull down your lower eyelid and check your sclera, and I'm going to check your conjunctiva. And it's pink, normal, everything looked great, no discoloration there. Now I'm going to check the pigment on her face. She has a mild bruise right there. What'd you do there? Okay, she dropped her phone on her face. She has some redness, but it's really cold outside, and she just had a baby, so she could be tired. Other than that, some mild acne. Looks good. Now I'm going to assess her lips, and her lip color is pink. No cracking, nothing like that. It looks good. Okay, now we're going to do her acuity. So you wear glasses. Go ahead and put your glasses on. Where's the clock at? Well, can't see. Go ahead and tell me what that sign above the door says back there. Okay, so your eyes work pretty good. Okay, next we're going to check her eyes. Her eyes are itself. Go ahead and take your glasses back off. Sorry about that. So I'm going to check for, see if her pupils react. And her pupils are reacting. Okay, now can you follow my finger? Good. Very good. Perfect. Okay. Her eyes were great. They were symmetrical. Her pupils looked good. They did react to the light. Now we're going to check for, or we just did the 6 cardinals field of vision, so we don't have to check for those again. Next, we're going to check her sinuses. And I'm going to kind of palpate on your face. I'm going to take your glasses off again. Should I put these over here? So I'm going to palpate for her facial or her frontal sinuses and stuff like that, and her maxillary sinuses. And those feel good. Is there any tenderness or anything around those areas? Okay, nothing up here. All right, everything is good. Now we're going to check the patency of her nostrils. So what I'm going to do is I'm going to hold on one side of your nose, and I want you to breathe in, okay? Okay, heard some mild congestion there. That one sounded better, much better, okay. All right, so next we're going to look into her nose with the light, just to check for any kind of deviation. Get some blood up there, Lexi. All right, her right nostril is deviated. Her left nostril looks pretty clear. She did inform me that she does have a deviated septum, so definitely her left is more deviated than her right. Okay, next we're going to check out her mouth, and I'm going to look for any kind of discoloration, any kind of dryness of her mucous membranes, any caries or anything like that. So open real wide. All right, now say eh. Her uvula looks great, it moved perfectly. Her soft palate and hard palate look good, her tongue looks good, her teeth look great. The sides of her cheeks look good. All right, lift your tongue up for me. All right, everything looks great. Awesome. Okay, next we're going to see if she can swallow and how it is. So lift your neck up. Okay, just swallow for me, okay? All right, her trachea was great while she swallowed. Next we're going to check her TMJ, see if there's any tenderness. Have you had any issues with your TMJ? Okay, no issues with your jaw? Open? All right, there's no tenderness or anything there. Okay, now we're going to check her mastoid and her tragus and everything there is to do with the ears to see if there's any tenderness. So I'm going to kind of palpate. Does that hurt at all? Does that hurt? Good. Have you had any issues with your ears? Good. Okay. All right, now we're going to do a whisper test. And what I'm going to do is I'm going to have you sit on this side of the bed. I'm going to go behind you. And I'm going to whisper some words, and you just repeat what I'm saying. Horse. Dog. Cat. House. Okay, she did great. Those were the words. Okay, now I'm going to check her lymph nodes. So I'm going to check the post auricular, so that's behind the ear, check those. Okay, the pre-auricular, that's in front of the ear. The occipital, that's behind the head. Those feel good. Okay, lift your neck up. The carotid ones, those are down the neck, and those feel good. And the submaxillary, right here around the neck, those feel great. No swelling of those, we are good to go. Now, I already checked her trachea for deviation, so that was good. When she swallowed, there was nothing going on there. The thyroid gland, while the patient swallows, I'm going to have her lift her neck up and swallow. And it moved perfectly, we're good there. We're going to check her carotid arteries, so I'm going to palpate and try to feel and see if I can feel both of them. So lift your neck up again. Okay, that one feels good. Okay, I can feel them both. Normal pulse, nothing crazy about those. Okay, now I'm going to have you do some head exercises. Are you okay with that? Okay, I'm going to check your range of motion for your head. So I'm going to have you tilt your head down, tilt your head back, one side, other side. Now rotate it. Good, good. Any issues with that? No tenderness, no aching? Good, perfect. Okay, now I'm going to check your shoulder strength. So sit on the side of the bed again. Okay, I'm going to push on your shoulders. You just try to push up. Good, good, perfect. Okay, now since you're sitting like that, I'm going to go ahead and check your posterior chest. Just take a normal breath for me. Bigger breath so I can see it. Okay, everything was symmetrical there, so that looked great. Now I'm going to check your skin. I'm going to pretend like I pull your shirt up. I'm going to look for some bruising, any kind of redness, any kind of discoloration, and she wouldn't have any, so that's good. And next we're going to check, I'm going to go ahead and listen. Okay, so now what I'm going to do is I'm going to start over here, take a deep breath. Okay. Take a deep breath. Take a deep breath. Good. Okay, now I'm going to palpate real quick. Okay? Now breathe for me. All right. Everything seems symmetrical when she breathes. We're good. And now I'm going to check the intercostal spaces. Okay? All right. There's two. 5. Okay. And I can palpate those just fine. That was easy. Okay, and I've already listened to the lungs, and everything sounded pretty clear. So next we're going to check her anterior chest, so that's the front chest. All right, I'm going to pretend like I pull her shirt up and just check around her chest. I'm going to give her privacy though, so I'm not going to do that right now. Everything looked good, no bruising, nothing like that, maybe some mild acne, but other than that, everything was good. So now I'm going to have you take a deep breath. And everything was symmetrical there, so that was good as well. Next, we're going to, I'm going to listen to her lungs on the front. So the 4 anterior respirations. Okay, take a deep breath. Take a deep breath. Deep breath. Take a deep breath. All right, and I heard lung sounds in all 4 quadrants, so that's great. Now I'm going to start with the heart. If you want to go ahead and lay down, you can. Let's step over here. So I'm going to listen to the 5 areas where somebody would hear the heartbeat. And so we're going to start up top. to go ahead and get the apical pulse for 1 minute. Go look at the clock over there. Her apical pulse was 71. Now I'm going to pause because I'm running out of time, and then we'll start another video.